With a relentless focus on excellence in healthcare, Pullman Regional Hospital presents the Health Podcast.
So why should you consider and what do you need to know about well woman exams? Well, let's find out with Dr. Kim Gaida, Medical Director of Pullman Family Medicine, part of the Pullman Regional Hospital Clinic Network. Dr. Gaida, thanks so much for your time. First off, what is a well woman examination?
Yes, be happy to. That term refers to a general health checkup specifically focused on screening for disease or other health concerns in asymptomatic women. And it includes, just to name a few things, cancer screening, immunizations, mental health screening, and reproductive counseling.
So how are these different from standard physicals?
Well, Bill, there's a lot of terms that are thrown around that are used interchangeably, but a standard physical refers simply to a head-to-toe physical exam, looking for the presence or absence of disease. So I think of like military recruits, where they're having exams where the focus is purely on a current state of health as it might apply to the ability to perform a job. But so a well woman exam will include a physical exam, but its primary focus is really more on prevention of disease. So it's going to include a comprehensive discussion about individual risks based on the woman's personal and family history, maybe her lifestyle choices like diet, exercise, and smoking, and that sort of thing. And then, of course, we discuss age-appropriate screening tests.
Got it. So that's really good to know. So you focus on prevention of disease during a well woman examination, and then you will do all the regular things that normally take place in a physical as well. Is that right?
Exactly, right.
Okay, so then what happens during a well woman exam? What kinds of things do you screen for? Tell us that. How does that work?
Yeah, so we follow some guidelines. The guideline that we typically use is the United States Preventive Services Task Force. So that has a set of recommendations for age-specific screening tests that are appropriate. So it's not going to be the same for everyone. And so these can be kind of lumped into some categories. For example, screening for heart disease, screening for cancer, reproductive and endocrinological issues, infection screening and immunizations, and then mental health screening as well. So if we take a little bit of a deeper dive into those topics, an example of screening for heart disease would be checking for high blood pressure, obesity, high cholesterol, and other, family history of heart disease, smoking, that sort of thing. That's oftentimes the well woman exam is the first time that women will be diagnosed with things like hypertension or high cholesterol, which then, of course, we can treat. Things like cancer screening is also a common thing that we do and address at well women exams. Cancer screening, such as cervical cancer screening with a pap smear, breast cancer screening with mammograms. We'll talk about colon cancer screening for women who are over 50. And then, of course, we do skin cancer screening just as part of the physical exam as well. And then, of course, most women think about the well woman exam as being primarily reproductive, addressing those reproductive issues, which we do as well. So we'll address contraception. We'll assist with pregnancy planning, and then also address symptoms related to menopause, such as hot flashes, and addressing risk for osteoporosis or low bone density. The other category I was going to mention is the infection and immunization. So, of course, in younger women, and we're going to be screening for certain infections like sexually transmitted infections, HIV, hepatitis C, and also providing immunizations that are age appropriate, such as tetanus shots, pneumonia shots, shingles, flu, that kind of thing. So finally, the thing that's often forgotten and is super important is screening for mental health issues like depression, anxiety, substance use, and then also, domestic violence or partner abuse is really important to address at those exams too.
That is really a comprehensive list, and I could see where this would really be something that all women would want to have. So then why are well women examinations important to consider for all women?
Well, I think a lot of times people only go to the doctor when they're sick, right? And they figure, well, I've had the visit, I've seen the doctor, everything should be fine. But those visits when they're sick are focused simply on the symptoms at hand at that time. And so we just don't have time in those visits to, check to see if they've had those preventive screening tests that we just discussed. And so a lot of times patients can go many years just having these intermittent urgent care visits, and then later can be diagnosed with a disease that we could have, picked up earlier, even prevented in the first place if we had an opportunity to do so.
Well, those are all really important points to consider. So then at what age or stage of life should women start having well woman exams?
Well, there's really no strict guidelines for how often a woman should have a prevention visit or when to start. But in general, we would recommend in starting in the late teens and early 20s, and then doing that about every 2 to 3 years, as long as the woman is healthy with no chronic conditions that need to be followed. And then as they get older, like 40 to 50, we start recommending yearly visits just because the likelihood of disease is going to increase with age.
So then are well woman exams done with your primary care provider, or does it have to be with an OB/GYN provider?
Yeah, well, these visits can certainly be done by an OB/GYN provider. But the thing is, if there are things that are detected that are not primarily gynecologic, for example, high cholesterol or high blood pressure, diabetes, that kind of thing, women are then referred on to primary care to manage those conditions. So, I feel like primary care doctors are really best suited for these types of exams because we have a real broad range of training to treat these different illnesses.
Right. And is there any other important information people should know about well woman exams?
Bill, the only thing I would mention is that most insurance companies these days will include annual wellness exams as a benefit that is not subject to their deductible. So that's a free opportunity for women to make sure that they're up to date on the recommended, preventive health services. And, it's also an opportunity to build an ongoing relationship with their primary care doctor. I think, as physicians, those relationships are very important because when we are given the opportunity to get to know patients when they're well, we can do a much better job taking care of them when they're sick, too.
Well, Dr. Gaida, this has been really fascinating and great information. Thank you for sharing your time today.
Well, you're very welcome. It's been a pleasure.
That's Dr. Kim Gaida, and to get hooked up with a provider and to learn more, just visit pullmanregional.org. That's pullmanregional.org. And if you found this podcast helpful, please share it on your social channels and check out the full podcast library for topics of interest to you. This is the Health Podcast from Pullman Regional. I'm Bill Klaproth. Thanks for listening.